And we are live. It's Dr. Justin Marchegiani in the house with Dr. Todd Brennan. Dr. Todd is a podiatrist. He's a holistic podiatrist. So we're going to be talking today about all things feet. We're going to be kind of have a root cause perspective on it. We'll compare kind of conventional podiatry versus your typical orthopedic surgeon. And we'll talk about some of the things that Dr. Todd sees with patients coming in with foot issues, plantar fasciitis, toenail fungus, chronic foot pain. We'll try to address it from a root cause perspective and try to give you that good root cause way that we can address some of these issues. Dr. Todd, welcome to the podcast. How you doing, man?
Doing well. Thanks for having me.
Nice to meet you. Well, you're taking time out of your day in between patients, so I'm excited that we're able to right on the first line here, right, address some of these issues. So why would someone go to see a podiatrist over a conventional orthopedic surgeon? And how are you different than just someone that's prescribing a medication to cover up pain in the foot?
Yeah, I mean, that's always the big question in our field is a foot and ankle orthopedic versus a traditional podiatrist. And, I think ultimately it comes down, as you mentioned at the, beginning and intro, is the getting to the basis of why you're having the issue, not just fixing the pain. And, the best way to try to, explain this would be giving you kind of an example of plantar fasciitis being a super common thing that we treat, which is, heel pain, heel spurs. Whereas if somebody were to see an orthopedic, they might tell you to stretch and ice and take Advil, ibuprofen.
Put you in a boot. Yeah.
Right. Correct. Whereas from a podiatry standpoint, we're understanding, and I don't want to use this as a blanket term for orthos in general, because they're not all like this, but, we're understanding that the mechanics of the foot and the functionality of the foot are leading to you having these plantar fasciitis type of pains. So, while stretching and icing are important, biomechanical control of the foot with an insert, an orthotic, the proper shoe, is also equally as important. And while medications might be an aspect of that, we try not to solely base it just on, taking pills to alleviate the symptoms or pains.
Right. I imagine probably most foot issues, would you agree? I mean, outside of like plantar fascia, from like chronic repetitive, like, running, on pavement, maybe you're a chronic runner. Imagine outside of that, probably most of your issues, I'm guessing, probably have to do with a lot of diabetes, blood sugar, insulin resistance complications. Would you say?
Yeah. I mean, diabetes is a huge portion of our practice, and
Yeah.
depending on the fluctuation of the blood sugar levels, are going to dictate what we see and how bad it may be, type of thing.
Yeah.
So yeah, that's definitely a big portion of our practice.
Yeah, that's a big one. There's a book out that came out last year by Gary Taubes, The Case for Diabetes, I think it's called, but it really addresses the underlying root cause of where diabetes, comes from. It's just excess sugar, excess carbohydrate. 100 years ago, we were consuming 4 pounds a year. Now the average person's 150. And if I'm only consuming 2 or 3, then someone else is consuming 300, right? So
Right.
It's just crazy. We have lots of excess sugar, lots of processed bad junky oils out there. So if we can get that down, that plays a big role. When I was, undergrad, I was in a surgery center, and I would be that person holding the diabetic limbs as they would be amputated off. And I had to
Mhm.
wrap these limbs up. And the conventional people there, the orthopedics, the general surgeon, they really weren't interested in getting to the root cause.
Right.
What's
Yeah,
your
I mean,
take on that?
it's important. We try to, a big portion of diabetic control, other than just food and diet, is exercise and making these people move and helping from a blood flow and health standpoint. And if your feet hurt, that's not too helpful, right? So, trying to make sure that these people can remain active and stay active, which will in turn decrease the need for hopefully medications, and also decrease the progression of the diabetes and how it affects the foot, is a huge factor to that.
Yeah, and you see patients down in Tampa, and you also
Mhm.
see patients virtually. I put your
Mhm.
link right at the top of the video. So if anyone's watching this and anyone has any chronic foot issues and they want to reach out to Dr. Todd, there'll be a link right down below. What's your link again, Todd?
Healthyfeetpodiatry.com.
Healthyfeetpodiatry.com. There'll be a link if you guys are driving and you want to have a click access. It's right there for you. All right, so we have high blood sugar. We know that can create a lot of problems. What about just the average person that's just running a lot? That's just that
Mhm.
wear and tear and that like compression on pavement. Tell me about that.
Yeah, I mean, we live, especially here in Florida with the nice weather, pretty active society, active people. So it's a lot of wear and tear on your feet. So it goes back to what we were talking about before, and having a proper support, not just orthotic, but a shoe as well. your foot constantly pounds the pavement, and it can lead to a lot of, issues. And it may not even just be with the feet, it could work its way to the ankle, knee, back, hip. So it has a big aspect or big product when it comes to those types of things.
So when people are running a lot, is there a certain orthotic? Is there a certain shoe that you like? Also, do you
Mhm.
try to get people to maybe move off the pavement, go on the grass, or maybe do hill sprints so you have less compressive force because that angle of the hill going up kind of dissipates the impact? What's your take on that?
Yeah, so from a shoe standpoint, there's a good solid amount of shoes. You have Ultra, you have Brooks, Asics, New Balance,
Yeah,
On, Hoka, all these shoes, right? And I
yeah,
always recommend for a patient, you want to add in an insert with that. Now, yeah, you could certainly start with a generic one, but I would certainly recommend going something more custom because it's going to be made for your foot, right? And it's going to give you the best contour in a good shoe, right? So the best combination is a good shoe with a good orthotic. As far as what you run on, I mean, there's all different pros and cons. So I think everything, running on just straight pavement versus incline and declines, and the way that your foot adapts and functions, and the way what muscles are being affected accordingly. Same thing with running on grass, where you're more of an accommodative running surface. Then you do open up the door for potentially ankle issues, right? Where it's ankle twist sprains versus a flat
right.
harder surface, right? So there's a lot of layers to it. I'm more of under the idea that, hey, have a good shoe, have a good support, and just wherever you want to run, and we treat it kind of accordingly based on how you're feeling.
Do you have any brands that you like that where you just see people tend to just do better on these brands of shoes?
Yeah, probably. I mean, Hoka, Ultra, Brooks, and Asics are probably the top four
Yeah,
from a running shoe standpoint. Now, there's other companies that are starting to kind of come into the mix. I will say some of the more popular companies like the Adidas or Nikes are doing a better job of trying to make a better shoe overall. But ultimately, those four probably are the best of the bunch.
and what about orthotic inserts? Do you recommend like a foot leveler's one, something that's customized with your weight
Mhm.
on a machine that shows exactly where your weight is being distributed and then customizing it according to that? Or do you just like a general one out of the box? What's your take?
Yeah, I mean, I think there's a multi levels to that answer because
Hmm.
not everybody can afford a super expensive orthotic, right? So
Hmm.
I think starting off with a decent generic one, there's one called Power Step that I recommend to all my patients.
Okay.
Get it on Amazon for 40-50 bucks.
Hmm.
I think it's a good stepping stone, but ultimately a custom one's going to be better. And this is probably the most important thing with a custom. And I think a lot of people make the mistake of go to a running shoe store or like a Walmart and Dr. Scholl's, and they stand on a mat or a device, and it scans their feet, and then they say, hey, this is the insert you need. The issue with that is a couple of things. One is that it's not really customized, right? Even though they're scanning your foot, they're still pulling something off a shelf, right? And two is the way the device or the machine is scanning your foot is your foot in a relaxed non-optimal position, right? So
Hmm.
what I mean by that is when we make custom orthotics here in our office, we actually have our patients seated and we hold their foot in a neutral position because that's the position we want the orthotic to hold their foot in for optimal functionality. Whereas if you're standing on just a flat scanned mat or screen or whatever it may be, your foot's now standing in a relaxed, in theory, painful position how it's functioning, and that's what we want to correct with an orthotic.
Okay, got it. And so you want one that's going to basically be in a relaxed position, and then you're trying to look at and see the highs and lows and just try to support those highs and lows accordingly.
Yeah, so when we hold the foot, we hold it in a neutral position, which there's a certain way you hold the foot to do such, and then we scan it, and that scan gives us basically like a topographical map of the bottom of the foot, so we can see any excessive pressure points or areas that need more support. But we can see that with whether it's calluses on the bottom of their foot or wear in a shoe, that we can say, hey, underneath the ball of your foot, we need to add more padding, or we need to cut out, or whatever it may be. Those are things that we do look at as well when we talk about making something.
Now, do you look at how your patients run, like if whether they're a midfoot, a front foot, or a rear foot striker? Does that matter? I mean, do you find that with their mid, if they're like a that heel's hitting first. It's kind of like they're hitting the brakes a little bit. Maybe that
Mhm.
creates more friction or more force. How much of the biomechanics are you looking at when people come in with foot pain?
I mean, we try to look at as much as we can. I mean, a lot of times just looking at the bottom of their shoe and or the bottom of their foot, even with callus formation, you get a really good glimpse into where their
Yeah.
pressure points are, right? And then we'll have them walk up and down the hallway and watch them walk too, which can be telling, right? Because ultimately, again, as you mentioned, fixing those biomechanics ultimately is going to lead to a healthier foot and be preventative in issues that may arise.
Do you like to see them being more midfoot over rear, or do you even like to see more front foot? What's your take on the biomechanics that's best for preventing injury?
Yeah, I mean, any runner, I mean, typically you're not going to go through the full stand, a 3 point gait cycle where you're doing heel to mid stance to forefoot. It's going to be a lot of
Right.
forefoot pressure, running on your toes, if you will, which is
If you're
which is
sprinting, for
fine,
sure.
right?
Yeah.
Correct. You know, but generally speaking, like the normal cadence of the foot, you're going to kind of do heel to roll into mid stance into propulsion and push off, right? That should be kind of what you're looking at. Depending on the speed, will decrease the amount of heel strike, if you will, as you progress through the speed of your cadence.
So you're wanting to be a little bit more midfoot versus rear
Correct. Yeah.
versus heel, and
Yeah.
part of that would be like having a good lean as well.
Correct. Yeah.
I find if
Yeah.
you're just too upright, right, like that, you're gonna be a little bit more heel. You kind of need that 15 maybe to 30-degree kind of lean, and that
Right.
kind of puts you up in a better position to midfoot strike. Would you agree?
Correct. Yeah. Yeah. You're not going to what we'll call a calcaneal gait where you're running and you're getting a lot of heel slapping. It's going to cause
Right.
its own separate list of
Yeah.
issues.
Yeah. If anyone's running and they're just like this, they're going to be heel hitting versus if they're running it with a little more angle. What
Right.
other simple cues can you give the listeners that will help them with their gait if they're running?
Yeah. It's always interesting because, you have a lot of people that come in that'll have issues or problems with their running and they try to think about it, right? And I find that sometimes that can lead to more issues than not about trying
Yeah.
to forget about it and run as normal as possible. Now, if you have pain or problems, you're going to run differently to accommodate for it. But
Correct.
if it's ultimately, if you have no issues, you want to get into that preventative category so you have the right shoes, the right support, so you don't get to that point, right? And if you do have an issue, I would try to get it addressed and nip it in the bud quick, because if not, it's going to lead to other gait problems, which is going to then turn into other issues or pains.
Okay. And then you like the Power Step insoles for just kind of off the shelf. And what were the insoles that you liked that were more customized that you had good success with? And you did it non-weight bearing as well, correct?
Yeah, the customizer ones that we do here in the office, where we hold your foot and we scan it with basically a three-dimensional iPad in essence. So,
Is there a
if you're
company you use for that? Like, is there like Foot Levelers or
well,
someone like that?
yeah, I mean the name of it is oh gosh, I just blanked on it. It's not usually as a patient, you'd have to go into like a
Clinician.
podiatry office,
Got it.
correct, to have it done. I wouldn't suggest to go into like a shoe store and have it done.
Got it.
Um, you're just going to get a more optimal, better fitting
If they
insert.
go into a podiatrist office, is there a certain technique or software they should be asking for if they go in?
No, I mean there's a bunch of different ones
Okay.
that are available. So yeah, forward motion is the name of ours. It just popped in my head. Yeah.
And you want non-weight bearing as well as weight bearing or just non?
We just do non-weight bearing.
Okay.
I mean, the old school method, you had people put a little bit more weight on it in like a foam box, for instance.
Yep.
But even older than that, they used to use old, plaster cast, and that was a non-weight bearing. You put it on, you manipulate the foot in the proper position,
Yeah.
and let it mold up. Yeah.
Okay. Well, let's talk about shin splints. So that's the anterior tibialis muscle that runs along the front of that shin bone on the outside. It kind of goes on the outside and wraps around the inside medial arch, and that kind of provides that good kind of arch support. And with runners, that you can get that so-called shin splints, that pain on the front, maybe the front outside, and that arch can go flat. Do you see people being able to reverse flat arches? Do you do any soft tissue work, or do you recommend soft tissue work to help
Mhm.
bring that anterior tibialis muscle back so it can pull that arch back into support?
Yeah, I mean, it's really just like stuff like physical therapy, strengthening, and then
Yeah.
going back to the orthotics are the big thing. I mean,
Hmm.
ultimately, foot types are kind of genetic hereditary. So if you have a flat foot, nothing's truly going to repair it short of surgical, right? But
Hmm.
ultimately, if that's the goal, is to avoid that, getting in a good support to take the pressure off that tibialis anterior tendon and the other tendons in the leg and the ankle, that's really the best thing that you can do for it.
Do you ever see soft tissue support help? Like someone comes in and does grasping or does a technique that really works on activating that anterior tibialis and activating that fascia underneath. Have you
Hmm.
seen that?
Yeah,
Activate that
yeah.
muscle work and pull that structure back.
Yeah, I mean, it just helps to build up, some strength and stability of the muscles themselves. Depending on the severity of their flat foot. Again,
Yeah.
that's going to dictate whether it's something and how much it can truly be improved. Now,
Hmm.
I don't want to say the word fixed because, again, if you're flat-footed, you can build up the strength of any of the tibialis anterior, posterior tibial, any of those tendons.
Yep.
But it's not necessarily going to recreate your arch. That's going to be short of surgical. That's not going to be something that's possible.
So, what else do you see to help people with flat feet, though, that can be helpful outside of I mentioned some of the soft tissue stuff? What else do you recommend to your patients?
Yeah, and again, I'm not to beat a dead horse here, but it ultimately comes back to orthotics, right, and the proper support because
Support and then PT stuff.
correct, yeah, if
Okay.
you're decreasing the pull of those tendons that we mentioned on the foot, which start in the leg,
Hmm.
it's going to eliminate a lot of that, foot issues, but also shin, calf, hamstring problems as well.
That's cool. Tell me about bunions. So the average person, we hear that word a lot. We see the big calcification on the side of the medial side of that big toe that sticks out.
Mhm.
Talk a little bit more about what are bunions, how do they happen, what's the root cause of it, and what do you do to treat it holistically outside of just coming in there and maybe surgically shaving it off? What are
Mhm.
some things that you can say, hey, this will help with the root cause?
Yeah, so bunions are again hereditary, and
Hmm.
I mean, you can get them from injuries, accidents, but primarily it's a hereditary problem, and kind of the progression is there's we'll call it an abnormal pull of some of the tendons that enter the foot, and as they pull and they progress, the angle between the metatarsal bones, starts to widen, and
Yes.
you get kind of slippage, if you will, of those tendons, and now they're pulling even more abnormally than they should, and then that's where you get the big bump on the side, and then the big toe starts to drift the opposite way. So, when we look at it being preventative and prophylactic with these things is, we have a patient that comes in who's in her 50s, whatever, 40s, and they have young children is, hey, we start to advise them now and early, listen, you have a bunion on both feet. You most likely got it from mom, dad, grandmom, granddad. It would be worthwhile for you to consider looking for your children to get in the proper shoes and support to align the foot to decrease those abnormal pulls and decrease the
Hmm.
likelihood of bunions from occurring. Um, will it stop it altogether? Probably not, but will it slow the process down considerably? Yeah, for sure.
So essentially, your metatarsals, these are your toes. Your metatarsals start to wing out, and so then your toes kind of start coming back in. So you get that big V at the edge of that medial big toe. Is that correct?
Correct. Yeah, yeah, pretty much. So, if you have, I don't think I have a bone model, or I'd show you. No, yeah, if you have your metatarsals like this, right, the pull of this one causes this metatarsal to start drifting this way, and then this
Yes.
one, right. So then you get that big V, and then what happens is you have
Yeah.
the toe now sits up here, and
Yep.
that the soft tissue starts to pull the toe, right. So
Pull
now
it
you
back
have
in.
kind of this effect where you have that the V, and
Correct.
that's where you run into that issue is it's a incompetence, for lack of a better term, of
Yeah.
2 to 3 muscles within the foot and the ankle that lead to the bunions to progress. And the
And
thought is if you support
mhm.
that, it's not going to happen.
And are there simple movements they can do when they exercise that will strengthen that, like step ups or like toe
Hmm.
extensions? Or, I mean, is it like women that wear more heels have that? Like, what's your take on, heels, wearing heels, certain types of shoes, and what any preventative movements they can do in the gym at home?
Yeah, I mean, shoes, especially heels, are a huge factor in
Yeah.
that, and can cause and progress bunions more rapidly because, especially if they're pointed, right, you're just kind of
Yeah.
forcing the toe over.
Yeah.
And then if you add in the hereditary component of things, it's going to make it even worse. So shoes are a big factor. If you already have a bunion, wearing nice, wide, softer toe box shoes are going to be important. Um, so those are big things that you definitely look at. Um, as far as the what was the first part of that question again? Sorry.
What are some movements they can do at home in the
Movements.
gym that could strengthen the foot
Sure. Yeah. So any
tendons?
type of, I like the ones that are going to build up more strength in the intrinsic musculature. So one is, putting a towel on the ground and like trying to pull it back with your toes, right?
Yeah.
Um, crunching it up. Another one would be taking like a foam block and cutting it into a bunch of pieces and picking it up with your toes and transitioning it to a bucket. All right.
Yeah.
Those are going to help to build up some of the strength short of the normal, as you talked about, calf raises, the ABCs of the foot and the ankle, right, where you're putting your foot through a full range of motion. Those are all good strengthening and stability methods.
What about like stepping on an unstable surface? You see some of these foam pads. What if I just did a step up on that pad, or did my one-legged deadlift from that where I had a little bit more instability? Would that cause some of those tendons and muscles to have to work a little bit harder?
Yeah, I mean, it's just building up that stability and that strength to the muscles and tendons on both sides of the foot and the ankle because of just that wobbly nature. So yeah, in theory, it's going to help build up that support. So the thought is, if you build up support, strength, and stability, and then combine it with a good shoe and support, it's going to decrease, hopefully, the likelihood of you developing a bunion.
Now, what about people that say, hey, shoes are providing too much support. Maybe we have to like not wear some shoes, go exercise shoeless. And then now your foot, your muscles, they're all going to work more individually, and they're going to be able to get stronger individually by having to grab that ground to kind of stabilize, versus the foot, it's providing too much support and it's almost making the muscles go to sleep. What's your take on, like, you see it with the Vibram 5-finger kind of shoes. You see people saying, hey, exercise shoeless. What's your take?
Yeah, I mean, I think, it's not that there's not some truth to that, right? Building up some strength without having the support or the shoe or an orthotic underneath of it. I know people who lift weights and do all that stuff is, grounding themselves, right? So there's definitely some truth to that. Our concern within the field of podiatry is just, just the progression and adaptation of the foot and the body. I mean, just like we need contact lenses or braces for our teeth or whatever it may be, right? I mean, there's the need for that medicinal stuff to help decrease that. I've treated plenty of people that have worn the Vibram 5-fingers or have gone to the minimalistic shoes who have issues because their foot's just not used to just the everyday wear and tear and just Mother Nature and just our body breaking down, if you will, with time,
Yeah, I'll do some of the step ups, and I'll do those on a plyo box, and I'll do single leg step ups shoeless. I find that's good. Or I'll put it like one of those foam pads on just to create a little bit instant. But I think that's a good way to do it because you want to make sure you're not holding weights that you could just drop it on your foot. I mean, that's kind of common sense, but people, it happens. I mean, it happens all the time.
It definitely happens. Yeah. So, no, I mean, I would. Yeah. I mean, when I do any workouts in the morning, a lot of times I'm barefoot, right? Or again from that grounding, but. Again, I pick and choose with when I do it. I'm not going to go out and walk around town with, minimalistic shoes or Vibram 5-fingers. Just because I still need the support for long-term walking and ambulation.
That makes sense. Let's shift gears and talk about toenail fungus. I mean, this is a hard one. I mean, there's topical medications, there's oral medications. They both can be really hard on the liver. First off, what do you think the root cause of underlying foot fungus is, outside of just being in an environment where it's on the floor, it's in the locker room? What's your take on that? And then kind of let's compare and contrast some of the topical and oral treatments.
Yeah, I mean, I think that's a big one. What you mentioned, right, is just the environment they're in. It's stuffed in a shoe that's hot and sweaty. You're walking around, or you go to a gym and you're barefoot. So it's very fungus is very opportunistic. So it doesn't take much to get it in the nail once you get it. Part of it's the growth of the nail, right? How long it takes for the nail to grow. You're looking at about 9 months to get a full length nail. So a lot of the treatments are stuff that you have to be really consistent with over a long period of time.
That's the hardest part,
right? If they're going to work. And I do think that there's a factor to it. And some of, some thoughts is going back to what our initial talking point was, sugar levels, and does the fungus feed on that, right? So higher sugar intake diets could cause for the fungus to proliferate and get worse, or just not go away. I certainly think there's probably some truth to that as well.
Yeah, my take is I try to get one of these guys here and put one. It's basically an electric toenail file, or you can use it on your nails. I'll do my nails like it just because I can just do it in like a fraction. I won't even cut them. I'll just do this twice a week and it smooths them out perfectly. But I'll put one of these guys on, and if I have a fungal toe, I notice you get that keratin debris, that kind of thickening on that nail. Mm-hmm. And that's kind of the fungus eating the keratin, and it creates this debris afterwards. That's that haphazard yellowy tinge. And my kind of take is I like to just file it down smooth so it feels normal. And then
Right.
I will topically apply the tea tree oil or the glycolic acid or the oil of oregano. And I find it, you get a better penetration. I find that when you have that keratin debris, that shell, you don't get as much penetration to where that fungus lives, which is a lot of times underneath that keratin debris. What's your thoughts?
Yeah, for sure. I mean, it's important to do a little bit of debulking, right?
Yeah.
Because you want that medicine to be able to truly penetrate it. Now, the other thing too is worth pointing out is some people can get thickening of the nail, whether it's to build up the keratin or even a yellowish tinge, for more of like what we call a dystrophic nail, which is just some thickening due to, again, biomechanical fault. So, say somebody who has a hammer toe where their toe is contracted, right? If they
Yeah.
walk more tip of the toe, in essence, your body's going to form a thickness to that nail due to that
Correct.
repetitive stress, right? That's more of a factor of, again, the functionality in walking. So it's a little harder to treat that than even fungus per se.
Right.
But still, thinning it out and allowing the medication to kind of really drop into that nail is going to be your best bet for clearing it up as much as you can.
Yeah, I find the hardest part is you start to look at that nail and you start to see it come out clean at the very bottom, right? Right at
Hmm.
that lunula. But you have to let it go all the way through because it's a battle where if you're not constantly hitting it, the fungus at the distal end, the end of the nail, will eventually move its way down and just take over that healthy keratin that's coming out. It's like
Yeah,
a
correct.
war you have to fight, right?
It really is, and you could get it to clear up, and then once you stop the treatments, it could come right back. It's vicious. Yeah.
Yeah, a lot of people they'll say once it's clear, you probably have to maintain your treatment for at least a month
Hmm.
after it's clear. Would you agree with that?
Yeah, that's what I tell most people is, once they've gotten to the point where they're happy with the nail and it looks good, continue with the treatments at least for another month, and some of them I tell them, depending on how long they've been battling it, do it even longer. It doesn't take much to just throw on a lacquer or some type of product on a nail daily for an extra month if you've been treating it for years.
And I find that you really need twice a day treatment. Once, a lot of times, not enough, especially if you put it on and then you put socks on right away. You probably just pulled it off on the sock. So you need
Yeah.
to kind of put it on, have a routine where you maybe have some sandals or walk around barefoot for 15 minutes while it dries, and then maybe
Hmm.
something before bed. A
Right.
couple of things that I've done that I like. I like the carousel with the glycolic acid.
Hmm.
I like these guys are good. The tea tree or the oil of oregano. These topical ones are nice. And also, I do like the nighttime patches too with the
Mm.
carousel. They have a
Sure.
nighttime one where it's the same thing here, but it's basically a band-aid
Just a
that goes
patch.
over it.
Yeah.
Yeah. So
Right.
those are pretty good, but I find you have to hit it twice a day. And I
Hmm.
also have found too, you notice that like white scale around the feet, that also can be a fungal thing too. And that could easily kind of migrate its way to that toe if
Correct.
you're in a sock or in a moist environment. I find soaking in vinegar once or twice a week, even just
Hmm.
diluted vinegar with some tea
Hmm.
tree can be really helpful. And then just using one of those, like a pummel stone or one of those things that just kind of
Correct.
grates the skin off the heel can be helpful too.
Yeah, yeah, absolutely. Yeah, just kind of like you said, a lot of times you can get a combo where it affects the toenail and the skin, right? So now you're
Yeah.
dealing with two different types of fungal problems. So, yeah, it's important to stay on top of both of them.
So you were talking to me pre-show that you like the tea tree oil topically
I
for
do.
the
Yeah,
toenail.
that's usually. I mean, there's a lot of prescription ones that are out there, or over the counter
Yeah.
antifungal. I've had the best overall results and patient feedback with the tea tree more so than anything. So that tends to be my go-to.
And it's not going to jack up your liver enzymes like maybe
Right.
the
Correct.
Lamisil would, right?
Correct. Yeah. I mean, Lamisil, it's really the only medication we prescribe. I mean, there's other ones that are out there, but that's the main one. And we always check typically before and about halfway through with patients what their liver enzymes are, so we can monitor it and make sure. And if there's any issues or fluctuations, we stop the medication and everything kind of drops back to normal. So I will say I haven't had a lot of people who have had issues with it, but again, we tend to be pretty conservative and monitor that closely to decrease the chance of that.
And that's the AST and ALT for
Correct.
the
Yep.
enzymes. What
Yep.
do you want it under? 30, 40?
Yeah. 30.
Under
Yeah. I
30.
mean,
Yeah.
I think textbook says if it triples is when you
Yeah.
should stop it.
60 or 90. Yeah.
Yeah. I'm more of along the lines of, hey, if your normals are at 30 and it pops up to 35, and it's not worth pushing your liver for a fungal toenail.
Yeah. Do you ever recommend taking N-acetylcysteine with it?
Uh, Not often.
Mhm.
I'm not anti it, but not often. No.
Okay. Because I know they use NAC even conventionally since the 70s to treat liver failure due to ODing on Tylenol.
Hmm.
acetaminophen. So I know it has some,
Sure.
hepatoprotective effects on it.
Sure. Sure. Yeah.
So what
Yeah.
else? Mhm.
Go ahead. Sorry.
What else are you seeing in your practice that you think would be beneficial for the listeners? We talked about flat feet. We talked about bunions, fungal toes. We talked about running. Anything you want to highlight about plantar fasciitis? Any feedback on that?
Yeah, I mean, I think the biggest misnomer in the medical realm is, people come in and say, "Oh, I have a heel spur," right? Um, which isn't always false, right? Heel
Yep.
spurs are there for a lot of the time with plantar fascial patients,
Yep.
but I think the key is that, and now this is for the bottom of the heel, mind you,
Yep.
the heel spur isn't what causes the pain, right? It's the plantar fascia, the tightness, if not micro tears within the plantar fascia
Yep.
at the insertion point on the heel. That's what causes the pain. So you could have the largest heel spur known to man, but you're not treating that. You're treating the plantar fascia, right? Now, if you have a heel spur on the back of the heel, more where the Achilles is, that's a different story. But specifically with plantar fasciitis, even the most aggressive way to treat plantar fasciitis, which is surgery, where you go in and release the plantar fascia, you're not touching that spur. So the spur is always going to be there. All right, and I think that's a very common misconception that we see within our field.
And so essentially, a heel spur is going to be like a little claw-like calcium deposit extension off the bottom of the heel. And so,
Correct.
for you're saying it's more the micro tears within the plantar fascia attaching to it, not that calcium deposit per se.
Yeah, the deposit and the spur is in essence your body's way of trying to shorten the pull of the plantar fascia so it doesn't hurt as
Hmm.
much, right? That's the generalized thought with it.
Yeah,
Obviously, that's not what happens. It becomes inflamed, and you get micro tears, and then the rest is history, and it starts hurting.
that makes sense. All right, we hit that. And then what about soft tissue on that? I always tell patients, as a chiropractor, I always found I had great results with plantar fasciitis. First off, you have to figure out what's happening. What are you doing that's causing it? Are you doing a whole bunch
Mhm.
of running on pavement? Are we getting stability back with better shoes? Is it some lifting stuff? Like, are you doing a lot of plyometrics? And then I find that when you go to sleep, that tissue gets very, very short at night. And the worst thing you can do is just get up out of bed and just stretch the crap out of that tissue. So I would tell patients, put a tennis ball at the bottom of on the floor of your bed. And before you get weight on it, just roll that ball under one foot. Just feel where it's painful and just get it nice and soft and loose. Switch to the other ball. And then over time, you can do a lacrosse ball, but about 30 seconds to a minute on each foot. That gets the tissue nice and soft. And then when you stand up, you don't feel all that nastiness of that pull and that pain because you've kind of made that dough, so to speak, that plantar fascia a little bit more pliable. Thoughts on that?
Yeah, 100%. That's the most common way that we know, with plantar
Mhm.
fasciitis, the whole post-static dyskinesia where you're sleeping at night, you wake up in the
Yeah.
morning, my heel when I get out of bed, right? So loosening it up 100%, right? Warming the engine up in a cold car
Yeah.
type of concept, right? So whether it's a tennis ball, golf ball, whatever,
Yeah.
to loosen it up. There's different types of splints that people can sleep in while they're
Yeah.
kind of cumbersome. They're
Yeah.
available to kind of keep it stretched out, but that's exactly the thought, is to keep it loose, keep it stretched. So when you get up in the morning and step down, that's not the first pull, is the weight of your body hitting your foot, right?
'Cause
So
usually plantar fascia, it starts off the day the worst once you start doing that, and then it gets better throughout the day, and it feels pretty good at the end. And then it's just reversing cycle. It just like it keeps on like Groundhog's Day. And so if you can break that, I find it helps.
yeah, correct. Exactly.
And then anything else you want to highlight about your clinic, about what separates you guys from like your conventional podiatrist or orthopedic foot surgeon? Because I know you mentioned you have some modalities.
Yeah, yeah, correct. I mean, so I think there's a couple things. I mean, we're a pretty tight group of, there's 7 of us total. And I mean,
Hmm.
6 of us have known each other for probably 10 years. We all did
Yep.
residency together. So we have a pretty close knit group of people. Um, we do offer a lot of different unconventional modalities to help some of the issues we've discussed.
Yep.
Whether it's laser treatment, shockwave, PRP, which stands for platelet-rich plasma, which
Yep.
is similar to that as stem cell, cryosurgery. We do laser treatments for toenail fungus. So
Hmm.
we have a lot of modalities, and I think another thing that helps separate us, and we try to do this, is we offer same-day appointments with our patients.
Oh,
Um,
cool.
I think it's important. I have patients come in a lot, or I've heard from patients who are like, I tried to call this doctor, but I couldn't be seen for 2 months. Well, if your foot hurts or you have an infection, you want to be seen as quickly as possible, and you don't want to have to go to the emergency room to get it done. So, we make it a big point to tell our staff that, listen, if there's an issue, get them on the schedule. I'd rather, be slammed and run, 10 minutes behind than have somebody that's out there walking around limping. So I think that goes a big way with our clinic is we try to do that. And, we try, I think just the overall um, environment that we try to portray is just kind of a fun, easygoing group of individuals, and we enjoy what we do, and we like interacting with the patients and keeping them coming back, treating them like family.
That's cool. So you mentioned, what are the injections you said? Was it stem cells and PRP?
Yeah, so stem cells, we primarily do the PRP because we have the equipment here in office. So
Got it.
it does reduce our cost to a degree, so we don't have to buy it from a company. Whereas stem cell does tend to be a little bit more pricey because we're now buying that from a company.
And that's platelet-rich plasma, correct? And are you
Correct,
taking the
yeah.
patients and then spinning it in the centrifuge?
Correct. Yep. Yeah,
And
exactly.
so what's the goal of that? So if we have like tendon inflammation or joint inflammation, are we trying to use that and injecting it into that spot of inflammation to help accelerate
Mhm.
healing? Is that the goal?
Yeah, so I'll use plantar fasciitis as the
Yeah.
example. If you have something chronic that's been hurting you for say a year, your body kind of puts it on the back burner and is worried about other issues that are at hand. So what the
Yeah.
thought with the PRP is, all right, well, let's take a chronically inflamed, painful area and just pepper it with the PRP. So we just do a bunch of injections in an area, and that stimulates the body to tell the mind, hey, there's a new problem at this heel. Let's go treat it. Let's go attack it. And hey, we're going to put the cells in there on top of it to help aid in that healing process.
And so you could do that for lots of different inflammatory parts of the foot?
Pretty much anything. I mean, I've done it for arthritis. Now, obviously, you're kind of battling against the bony component
Yeah.
there, but anything soft tissue, pretty much PRP would work on.
What about like chronic ankle sprains, things like that?
Yeah. Yeah, so same thing. You can build up some of the
Hmm.
the, the strength, if you will, like through PT. PRP can also help with just the tendon
Hmm.
healing or ligamentous healing. If that doesn't seem to do the trick, then you're kind of stuck with surgery as your last ditch off option.
And what about cold laser, red light, or like a level 4 laser? Do you use those too?
Yeah, 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 correct. We use the level 4 red lasers. Same thing for a lot of soft tissue types of problems.
Inflammation?
Yeah, correct. All different types of things.
Do you use the infrared frequencies too? Red
Sometimes,
light and
yeah,
infrared?
yeah,
That penetrates pretty deep. So you can really help a lot of like chronic pain, chronic inflammatory issues, calm that inflammation down.
correct. Yep.
What else? What other modalities do you have? So we hit the red light, laser, infrared, level 4. We talked about the PRP. What else?
Mhm. Yeah, so we do cryosurgery. We have two
Mm,
different types of cryo. So we have a cryo machine that's more specific for acute injuries, right? Ankle
okay.
sprains, tendinitises, looks like a wand, and it just blasts cold air through nitrous on the foot to
Mm,
get the sub cold temperatures. Um, and then I do cryosurgery, which is more of a minimally invasive procedure that's done for people with chronic like neuromas and nerve pain.
yeah.
Do it more in the ball of their foot. And again, it's the same concept, if you will, as PRP, where you're basically trying to stimulate a chronically painful area and allow your body to replenish and regenerate and heal itself in essence. So yeah, that's another alternative treatment what we offer.
Excellent, Dr. Todd. Well, so just to be transparent for the listeners, healthyfeetpodiatry.com is your website. They'll put a link down below if you guys want to dive in deeper. If you want phone support as well, that is a service as well. So if you guys want to just run things through Dr. Todd and figure out if what's the best option if you have a chronic foot issue, that's a good option for you. Anything else you want to leave the listeners with today, Dr. Todd?
Yeah, I mean, you use your feet every day, right? They're the foundation of your body. So, take good care of them, and make sure you're getting ahead of any issues that may be there. Don't ignore them because they typically don't get better on their own.
Excellent. Well, I appreciate all the great information today. It's nice to see there's other modalities that you can do besides just the conventional surgery and medication. So it's great to see that
Of
you've
course.
integrated more things in your practice. Awesome.
Yeah, yeah. Thank you.
All right, excellent. I'll say bye to you after we cut the feed here. Everyone at home, if you enjoyed it, there'll be links down below. Feel free and put your comments down below. Love to see what you guys think and respond back. All right, guys, have an awesome day. Take care, y'all.